Good evening and welcome to Acupuncture and Surgery, What You Need to Know, hosted by the HSS Education Institute. We have an exciting program for you this evening. During this program, we'll cover a variety of topics, including what kind of patients benefit from acupuncture during surgery, how it functions, advantages of using this technique, and how HSS is leading research and implementation in this area. My name is Marko Popovic. I'm a research coordinator here at HSS. I work with our guests joining us tonight on acupuncture and meditation research initiatives. Our guests today are Dr. Stephanie Cheng and Dr. Christopher Lee from the Hospital for Special Surgery. Dr. Stephanie Cheng is a board-certified anesthesiologist and medical acupuncturist. She directs the perioperative integrative medicine program here at HSS. Her work integrates medical acupuncture into multimodal approaches for post-operative pain control and recovery. Dr. Christopher Lee is a board-certified anesthesiologist specializing in regional anesthesiology and acute pain management for orthopedic surgery. His research focuses on the integrative medicine techniques to improve perioperative care for orthopedic patients. We are thrilled to have both of you here today, and thanks for joining us.
Thank you, Marko.
Thanks for having us.
So in this first part of this webinar, we're going to discuss who is the right candidate for acupuncture and how it works. So who are the primary patients that can benefit from acupuncture during surgery, and what specific conditions make them suitable candidates?
So if you're coming and getting surgery at HSS, you're a candidate for acupuncture. We can perform acupuncture on nearly all surgeries that we have at HSS. Particular patients that do quite well are patients with anxiety, depression, chronic pain, or a history of postoperative nausea and vomiting. These patients have particular points that we can use acupuncture for to help them with all of these issues, maladies, and help alleviate them and help with that post-op recovery period.
That doesn't mean that if you don't have, if you're perfectly healthy, you can also benefit from acupuncture. It really just helps your own body's ability to heal, enhance itself. So our bodies are trained to heal themselves. Like prior to even the rudimentary medicine back, way back when. Your body's ability to heal. I mean, just from a paper cut, you can see, your skin's going to grow. Your body's going to send blood vessels and other sort of healing molecules to that area. And with the use of acupuncture, it really just enhances your body's ability to do that. So while it does help with specifically postoperative nausea, vomiting, pain control, people with anxiety, things like that, it really can help everybody. So anybody, honestly.
In which type of surgeries is acupuncture most used, and why are these surgeries particularly suited to this technique?
So at this point, for us, Chris and I are joint OR anesthesiologists, but we also branch out. But typically, we do hips and knee replacements, and that's sort of our most common procedure at this point that we provide acupuncture for patients that are coming in, simply because the surgeons that we work with have really bought into this and they want it for all their patients. So we're tied up there. But that's not to say that we're not trying to expand into like spine and sports and things like that. But we have a lot of room to grow here. But typically, as of right now, most of the patients that we're doing are for total knees and total hips.
The basis for the protocol that we use in the operating room, where Dr. Cheng has added 2 points to, was created actually for PTSD in soldiers. And soldiers, you can imagine a fully suited up military person, they would have a helmet on, fatigues, gloves, boots, which cover so many acupuncture points. But something that's left open is the ear. And the ear also has a map of the whole body on it. So we can use those points during a surgical procedure where the lower half of the body is sterile. We're avoiding that, but we have the whole entire upper half of the body, and particularly the ear, that we use a specific protocol to help with all the issues that we mentioned previously: anxiety, depression, pain, nausea. And so that makes joints this specific type of surgical procedure that we are quite attuned to, and this procedure or protocol works well for.
Yeah, and the protocol itself is not specific for total hips or total knees or the hip joint or the knee joint. It's a broad it covers a lot of broad things. So it's not just, oh, I'm going to do the hip point or I'm going to do the knee point. I'm doing things for your whole body. I'm doing things for anxiety. I'm doing things for fear. I'm doing things for inflammation specifically. I mean, you can imagine inflammation is very, very important post-surgery. You're creating an insult to the skin, and so your body creates this inflammatory response, and that sometimes can cause a lot of pain. So by having certain points that decrease the inflammation, it can decrease the pain that you might feel post-operatively. Maybe not all of it, but a little bit of it. And anything that we can add to what we already have available with, regional blocks and things like that can really just help with the total experience.
What are the specific considerations for using acupuncture during surgery, and are there any contraindications?
Some considerations that we think about are one that we've previously mentioned, what part of the body is available to us, because that tells us what parts of the body and what acupuncture points we can use. So that's one. What position is the patient going to be in also is going to change what points we have available. And in terms of what contraindications that we have, well, one big one is pregnancy. And there are certain acupuncture points that can induce labor, and so we avoid acupuncture in pregnant patients. Then also, if you had an allergy to the metal, which is stainless steel for the needles that we use, that would be another contraindication.
Yeah, they won't buy us gold needles, so I mean, I don't know.
So, yeah, skin infections, and then if you have a pacemaker, let us know. We can do acupuncture. If you have a pacemaker, we'll just use specific points.
What about if someone has any ear piercings, things like that? What would you say to them?
Well, generally for surgery, we ask them to take off their jewelry and things like that. So it's usually not a big deal. It's a little bit more challenging, not totally off the table. If you've had surgery for let's say you had cancer and you had parts of your ear removed, sort of makes the anatomy a little bit more difficult to figure out. But we can also, just because we use for our protocol the ear doesn't mean we can't use other body points that are available to us. When I was figuring out what to do, sort of being able to scale this to all sorts of patients, I was thinking to myself, okay, we're HSS, right? So we might probably going to have hand surgery. So there's a bunch of microsystems that the ear is one of them, the hand is the other, and the scalp is the other. But I didn't want to do the hand because, okay, what happens if you're going to have hand surgery? I didn't want to get in the way of the surgeon, because that's the last thing that we wanted to do, is get in their way, potentially cause infections, et cetera, et cetera. So we have access to the ear. But if we don't, and they're doing a total knee, we do have access to the hand. So we could potentially do some different body points to help with other things as well. But the protocol itself that we use currently is just the ear. But yeah, piercings typically have to be removed, so that's not usually a big deal.
How about acupuncture for patients with chronic pain conditions?
Acupuncture for chronic pain conditions, perfect situation for patients to come to us. Actually, with our wonderful chronic pain team, they will see patients preoperatively, and many of them will actually request or recommend that they get acupuncture intraoperatively. They pop up on our list, and then we can provide that for them. Acupuncture specifically will release these feel-good chemicals, which are our endorphins, as well as endogenous, or just our body's own painkillers. And so both of these are released during acupuncture, can really help with patients that have chronic pain, who have a tolerance to opioid medications, and this is a adjunct or a complement to all of the multimodal pain regimens that we use. Like Dr. Cheng mentioned previously, our regional anesthesia blocks, our neuraxial blocks, and then both opioid and non-opioid pharmaceutical medications that we use.
Yeah, importantly, we want to make it clear that we're not taking anything away. We're not withholding anything else. This is just another way, another modality to really enhance everything else that we're doing. It's not something that we're doing this, so we're going to remove everything else from you. We're doing this, and if you need the other stuff in addition, we hope it'll decrease the amount that you actually need. So
that's why we call it integrative and complementary medicine.
That's right.
So we're helping.
It's not an alternative. It's integrative.
That's when I enroll patients for you, that's the most common, or some people ask, so I'm not getting anesthesia at all? Just acupuncture? Yeah.
Is that the question?
I'll bring that up.
Oh. And you explain it well
Yes,
for us.
I do.
Yeah. Good. I'm so glad, Marko.
So we're so happy.
What are the mechanisms through which acupuncture improves surgical outcomes? How does it work, really?
Okay, so acupuncture, as we understand it currently in today's language, we don't really have a language to explain how acupuncture actually works. There's a number of theories. I'm not going to go into any of them right now because that's a lecture in itself. But the way I explain it to patients is that it, again, what I was saying before, it uses your own body's ability to heal itself amplify. So as we age and as we just interact with the environment, your body is hitting all these insults, you know, the wind, the cold, the hotness, things like that. Your body's constantly trying to fight all of this to maintain homeostasis. So acupuncture is actually trying to bring you back to homeostasis, to your body's ability to heal itself by using things like endorphins, things like anti-inflammation molecules, your ability to, for lack of a better word, tolerate the pain. Like you're not scared of it. You feel good. So a lot of our patients are like, you know, doc, like I feel the pain, and right, you just had surgery. You're going to feel the pain, but it feels so good. It feels so good. So our very first patient was in October 18th in October 11th, 2018. And she had something like 27 surgeries. And she said that this was her biggest surgery. And then, so me and the surgeon, we went out and we're like kind of looking at her. I was like, so how did it go? And she was like, well, you know, I've never felt this good. I've never felt this good. I've had 27 surgeries and I've never felt this good. So we kind of looked at each other, me and the surgeon, and we're like, I think we have something here. So you can imagine, right? So if you're feeling good, you're up, you're working with physical therapy. You're not just like lying there feeling sorry for yourself about the pain. Absolutely, feel sorry for yourself about the pain, but you do need to work physical therapy. You do need to get up to prevent anything from, you know, the scar tissue from forming and being able to have range of motion, et cetera, et cetera. So it sort of comes at you from a number of different things: the physical, the mental, and sort of the overall healing of your body, essentially.
And I can't stress enough that mental portion in that post-op recovery period and how important it is, and how acupuncture can really build that up and make you feel excellent. I just had a patient last week. So if we're thinking all the way from 2018 to 2024, we're having patients in post-op that are asking, why do I feel so good? I feel like giddy, I feel happy. And that even if they are, like Dr. Cheng mentioned, in pain, they are not bothered by it. So there's two different parts of pain that kind of get separated here, where there's a pain rating of how much pain you're in, but there's another rating of how bothered you are by it. And acupuncture can really help, as well as meditation can really help with reducing that unpleasantness factor of the situation you're in, which then allows you to get moving, get healing, and get out of the hospital.
Next, we're going to move into the pros and cons of acupuncture. So what are the documented benefits of using acupuncture during surgery, particularly regarding post-op pain reduction and opioid dependence?
Well, I mean, you're helping us do all of the research here. So we've actually done a number of research trials here, both, you know, sort of observational and randomized control. And you're helping us do this big, massive one right now. We're almost done. We're almost done. Close. So close. But the ones that we've completed, it's actually shown post-operatively to decrease the amount of opioid usage from for total knee specifically, from day 0 all the way out to day 30. So in prior to us instituting the acupuncture, we looked at sort of like a retrospective, and it looked like about 9% of patients were able to do 15 pills of 5 milligram oxycodone or less. So that equals to about 112.5 oral morphine equivalents from day 0 all the way out to day 30. So anything from the moment you got into the hospital, anything that you took all the way out to day 30. That was 9%. When we started instituting the acupuncture, on our preliminary data, we saw about 27.9%. But then when we came back with the study, it came back to 65%, with 17.5% of patients doing 0 opioids. We know of more outside of the study, but within that study, it was 7.5%. So did I say 17? I meant 7.5. So 3 patients of the 40 that we looked at. So you know, that really signals something really great. And again, it's not that we're withholding the opioids. It's just that patients didn't need it as much because they were directing their own opioid usage when they were home.
Just to recap that.
Yeah, I'm sorry.
65% of patients that did get acupuncture were able to keep to a low dose opioid regimen.
Right.
Compared to only 9% that didn't get acupuncture were able to keep to that same low dose regimen.
Yeah. Thank you, Chris. I do talk a little bit fast, so I have my people here around me to help me. Yeah.
We got you.
Yeah. Thank you. Thank you.
So what barriers exist to the widespread implementation of acupuncture in surgical settings, particularly in terms of availability and training of practitioners?
So one big thing is, or I guess two, I'll say there's two big constraints. One is time and the other is money.
Yeah.
Getting certified as a medical acupuncturist is for a physician, a year-long course. It's a 300-hour course that requires a lot of your time and also a lot of your money. So that's one big barrier, because if you're already a practicing physician, it's tough to take that year off and take that time to get this very important and very powerful tool. And then state by state, as well as hospital by hospital, are going to have different regulations, different laws on credentialing and licensing for acupuncture, who can practice, who can't. And in some hospitals, you have to talk and fight an uphill battle with administration to get this type of procedure and tool allowed in your hospital. So those are some big barriers.
Yeah, we're really lucky. HSS was very, very open to bringing this to the operating rooms, especially since, there was no one else really doing it, or at least widespread, that we could point to saying, hey, this is successful. So the fact that I had the support behind me to do this at such a renowned institution, it's, really kind of amazing. Especially, people, when I go to conferences, they're always like, how did you get them to do it? And I'm like, okay. I had a lot of great support, and that was great. We are in New York State. Unfortunately, it's one of the, fortunately or unfortunately, I have two minds about it, that it is one of the more restrictive states, so you do have to have a certification in order to practice. But in other states, in I think the vast majority of states, all you have to have is an MD license, which I also don't agree with. I think there should be some training. We're actually trying to lobby New York State to, so if there's any lobbyists out there, we're happy to have a chat with you to see what we can do. But we're trying to get it so we've developed this certificate program based on the protocol that we use here at HSS. It's a weekend course. It teaches MD to do acupuncture very specifically, just these 8 points. It's not widespread in terms of the acupuncture itself, but just these 8 points. So we're hoping to spread it out to other people, but we're legislation and government is very on the slower side.
But on the opposite of the slower side, as a plug, just for our institution, HSS won an award for a most innovative hospital because of the intraoperative acupuncture that we're doing.
Yes. Innovative hospital program, hospital winner of 2023, health.com. You can look it up.
So what are the potential risks and side effects associated with acupuncture during surgery, and how can these be mitigated?
Low. The risks are so low.
Yes.
The risks are very low. Go.
So I was just going to say, very low, very few risks. One of the biggest risks of acupuncture on patients that are awake is something called needle shock, where patients who, even if you're not afraid of needles, get poked with a needle and get lightheaded, get dizzy, need to lie down. The great thing about intraoperative acupuncture is you're already under anesthesia. So that's not a worry. That's not a bother. You're not going to feel that poke. You're not going to be bothered by it, and you're not going to remember it. So risk very low. We're going to do things carefully. We're going to do things effectively also. And so we're going to make sure that there's not any infection or not any trauma to any of your anatomy during this type of procedure with the needles that we use. They're also very, very tiny needles. You're going to get an IV in the pre-op holding area that is many times larger than the needles that we use for acupuncture.
I think one patient called me and was like, what's this bruise on my ear? And I was like, oh, that's from the acupuncture needle. She's like, oh, okay. That was great. The acupuncture was great. So if, we'll take it. We'll take a bruise if it can lead to an, oh my God, that's great.
Absolutely.
You've done it to me twice in my own office.
Yes.
Yes. Not for surgery. Just sitting at my desk.
Yeah. And you had a great experience with it.
Yes,
You get a
I
little
did.
bit euphoric. Needle-phoric is what I call.
So now we are going to go into the implementation and future directions of acupuncture. So how has the Hospital for Special Surgery successfully integrated acupuncture into its surgical program, and what outcomes have been observed?
Yeah.
Take it away.
I talked a little bit about this. So back in 2018, I with Dr. Mike Ast, we got together and we are like, hey, let's try this and see what's going on. And it really worked out. And since then, we've had, I would say, over like at least 3,000, 4,000 patients go through this. And it's ranged, in terms of neutral to, in terms of benefits, totally neutral, where, they may or may not feel benefit, because a lot of times you don't know what it's like to have acupuncture in surgery, so you don't have anything to compare it to. Although some people do. Some people had one knee with and one knee without, and so we do have like your own body's comparison. But most people don't. So they're like, yeah, that's the acupuncture was fine. Like, where's my physical therapist? All the way out to patients who are like, oh my God, it saved my life. It was so great. And I feel like, I don't want to speak for anybody, but for me at least, I think what it is really done is it's offered another alternative to everything that we've already have. We have a lot of things available to patients to be able to help with pain control, to help with nausea and vomiting, to help with anxiety. But to have another thing that's non-pharmacologic, that is so effective, that we found with our research and just patient surveys and things like that, is really quite unique, one, and hopefully we can spread it out into the rest of the U.S. But as of right now, as far as I know, scaled to the way that we have done it, HSS is the only one that's been able to do it that way. But yeah.
Dr. Cheng mentioned Dr. Michael Ast. He's one of the hip and knee surgeons at HSS that is our staunchest supporter. And I'm going to take this quote that I have heard him say many times, and it's that out of all the protocols or all the changes that we've had at HSS throughout his entire career, he says that intraoperative acupuncture has shown the most significant improvements in his patient's post-operative recovery. And so I will keep repeating that every single time I'm asked.
We're not putting words in his mouth. He will say the same thing.
He tells patients that every morning.
So what ongoing research is being conducted to further validate the efficacy of acupuncture and meditation in surgical context, and what future developments are anticipated?
So you know this very well, Marko. There's a current meditation study called the Mindfulness Meditation Intervention Study, or MMI, and we only need one more patient for this. Yes, one more patient for this particular study to finish enrollment. And it's one looking specifically at patients with anxiety and depression that are coming in for knee surgery. Patients that have lost the previous use of a joint, can't do what they normally enjoy doing, and a lot of that population can get anxious, can get depressed. And so we're looking at a audio intervention that's a guided meditation that patients will get and can listen to preoperatively, perioperatively, and postoperatively, and then look at both anxiety and depression symptoms as well as pain out to 90 days after the surgery. And we're going to see, this is a randomized control trial, so if you do enroll, you either get the meditation intervention or you do not. But that's one way that we're looking at another non-pharmacologic intervention that has potential for helping not only the physical side of functionality and pain, but really that mental side, that anxiety or depression that can come with joint, or the need for joint replacement, or also that recovery period where you're getting your skills back and getting your movement back.
Well, and everybody in that study is getting acupuncture as well, where it's like we're using what is now standard of care for us, and adding another modality and really trying to figure out, because our main goal is to try and figure out if there's modalities and things out there that we can use that are non-pharmacologic, right? To allow again, I'm going to say this over and over again, but allow your own body's ability to heal without using these other things. I'm not saying that those things aren't important. Take your NSAIDs, take your Tylenol for those first 3 days. You want to help as much as you can decrease the inflammation.
We don't give awards for most pain felt.
Exactly.
Take your pain meds
exactly.
too.
And we're not going to grow cartilage for you either. So you need to have your hip and you need to have your knee done, if your surgeon says so. But we're just using these methods to try and amplify your body's ability to heal itself. And I will say that till, I have say that until I'm hoarse.
So is acupuncture during surgery only done at HSS? How can HSS patients request this? And where else is acupuncture during surgery available?
So we hope to bring this to more patients throughout the country. We are traveling around the world, around the world, I guess, and around the country to try and train patients. Again, we have the limitation of the state as well as the limitation of the institution itself. But as we do more research, people are buying into it, and more people are looking to have this addition to all of their, the nerve blocks that you have in your back pocket and the opioids that nobody wants to have in their back pocket. So we are trying to do that. As of right now, that we know of, scaled, again, only at HSS. So,
So with that in mind, when you come in and you know you're going to get surgery, you're in your surgeon's office, we want you to emphatically ask them, tell them you watched this webinar, you heard about the acupuncture, and you like to request it. If you request it through the surgeon, we will hear about it, and then we can make sure that you get that acupuncture during your procedure.
Yeah. We do have we get the list. So, talk to your surgeon's office. That's the best way.
What policy changes and advancements are necessary to support the broader integration of acupuncture into standard surgical care practices?
It's like we read your mind, Marko, in terms of the questions. Like we said, just like standardization, more research, getting the state to the state level to get these exceptions for just these 8 points.
And I would say acupuncture education, acupuncture literacy, and getting that out to not just anesthesiologists, but to surgeons, to hospital administration, to patients like you, and getting people more aware, because acupuncture research has really blown up in the last 10 years. There are skyrocketing amounts of papers being published. We do need more papers and more research to be done at a high quality level, more randomized controlled trials, and more standardization. That's one of the bigger issues that we have in research. So if we get some standardization of protocols, like the one that we are going to go around the world teaching,
around the world,
then that can be an ongoing and a next step toward getting this into more operating rooms around not only the country, but around the world.
Yeah, I mean, I see ourselves as translational scientists. We're literally translating something that was developed thousands and thousands of years ago into sort of Western language and trying to figure out how to get that across. I mean, if you like Google acupuncture, the first thing that comes up is like acupuncture is a pseudoscience. And we need to, that's from way long ago, and I think the thought process is now has changed a little bit, and it's a little bit more mainstream. People are asking for it. Patients are asking for it. We have to meet that demand. We do, and we're proving that it works based on our research. So it's not just something we're just talking about. We're backing it up.
Speaking of asking for it, I think that they're asking for a little Q&A session.
Yeah, I know.
I'm scheduled for total knee replacement next week. Is it too late
No,
to ask for that?
No,
it's
it is
not. Talk to your surgeon's office. They will contact the anesthesia office, and
And then we will find out.
and
we'll
we will
get it
find
done.
out. And we will find out. Yes.
Can you speak about the costs? Is this something insurance covers?
You will not be charged extra for this if your insurance does not cover it. So Medicare does not cover it, but we will not be billing you for it. It is a value added. The hospital has decided that because it helps with other things, it's a value add. So it's not like you're getting acupuncture and you're paying for this. It's like you getting your acupuncture. You're less nauseous. You're able to go home the first day, so you're not doing into the hospital. That's kind of how we're functioning at the moment. But as this gets more popular, hopefully Medicare will start covering it. But you don't have to worry about that. It's not going to be an extra cost to you.
So it seems a few people have asked about when you should do this. Can you speak to whether this is only done during surgery or whether you can get it post-op as well? Actually, a lot of patients have asked me about this after the surgery when I saw them.
So as of now, at HSS, we are only doing intraoperative acupuncture, as we're to anesthesiologists as well as medical acupuncturists. We're always in the operating room, so we're performing acupuncture there. We do, if patients are interested, recommend getting acupuncture post-operatively. We say for at least 6 weeks.
No, 3 months.
3 months.
Don't have it around the site of the surgery.
But you can have it on the body. You can have it on the ear.
Also talk to your surgeon about it. Like ask them to make sure. When I ask, they say 3 months. But actually, you can do other body points. You don't necessarily need to do local points. As you do points, like that's not right around the area that you had the surgery. That actually helps with, there's, I'm not going to get too much into it, but there's local benefits, there's segmental benefits, and then there's general benefits. So you can avoid the local for three months, according to what your surgeon says. Sometimes maybe they'll say 6 months. Listen to your surgeon.
Yes.
Listen to your surgeon. Listen to your
Absolutely.
surgeon. Yeah. And then pre-op. If you do pre-op, you can actually have your body amp up as well. Yeah. And then they can do whatever. Yeah.
We've had
But
many
again, ask your
patients that when I come in and talk to them the morning of, and I say we're going to do some acupuncture for you, it's like, oh, I go to acupuncture every week.
Yeah. And we're like, excellent. You'll be
Yeah.
primed for
Yes,
this.
it's perfect.
You'll be primed for this.
Some participants have been talking about other sort of conditions that they're having. Can you discuss applications of acupuncture for pain to other conditions or more generally?
Yeah. We specialize in musculoskeletal as we work at Hospital for Special Surgery and surgical. So there are acupuncture. Acupuncture can be used for many, many disease processes. Low back pain and musculoskeletal ailments are the number one complaint or things that people go to acupuncturists for in the United States. So there's the acupuncturists in the U.S. are very, very used to treating those kind of pains and aches. So find an acupuncturist. There's a number of ways to do this. Google is the number one to do. And you can look up licensed acupuncturists are those who went 3 years to acupuncture school, and then medical acupuncturists are acupuncturists that had MDs and got it. So those don't get, there's not, I mean, there might be differences in approaches, but both are licensed.
And that being said, while musculoskeletal are the most common things that patients will come in for acupuncture, if you have any emotional, mental, spiritual issues or ailments, acupuncture can also be beneficial for those. And something else I just wanted to mention is that we talked about Medicare earlier. Low back pain specifically is what Medicare will cover acupuncture
Correct.
for.
Correct.
Some people have been asking about the needles. So can one of you touch on maybe what kind of needles are used?
So I guess this question is silver beads versus the traditional lung. You want to take this one?
So at HSS, we specifically use their traditional, we have both long and short needles. They're stainless steel. They are very small, and they will stay in for about an hour long. But again, you're under anesthesia, you're asleep, you're not going to feel those, you're not going to be bothered by those. The silver beads do exist. We do not use them at HSS. They can be used by an acupuncturist and may stay in the body for 3 to 5 days and naturally will fall out. Just make sure you count all of them on the way out. Yeah. But at HSS, we use the traditional stainless steel needles.
And someone else asked, are the benefits of acupuncture described a result of the treatment during the operation or are subsequent treatments necessary? Specifically regarding the post-op nausea and reduced reliance on opioids.
So I think that this question is asking, do we do multiple treatments?
Yeah, afterwards. Or if
And
it's just,
all of the research that we have discussed is off one treatment that happens intraoperatively during the procedure.
Yeah. And if the question is asking, is there necessity for like opioid medication?
I think it's asking if you need more acupuncture, like when you're
Oh,
at home or
okay.
something like that to
Yeah.
like prolong the
Yeah.
effects.
I mean, we don't, again,
Yeah.
like Chris said, the studies that we've talked about and all the patients that we've done is reliant on just the one treatment that we know of.
And you can't show up to their house 2 days after they do it.
Right. I don't think that would be, probably not.
How often are treatments recommended for chronic pain?
So if it's
Regarding the acupuncture, I guess.
This is not something that we do again, but if you're having an acute exacerbation of something chronic, like let's say you have chronic back pain, but you have like an extra flare, you can go once a week kind of thing. And then once you get it under control, every 6 weeks, every 2 months. As Americans, we're not very good at taking care of ourselves when we feel good or, feel normal, quote unquote normal. But chronic conditions do need that little amp up every couple months or so.
So someone is asking, I'm scheduled for a revision of a recalled knee replacement in December. I've had a lot of surgeries and get very elevated blood pressure. Can I start acupuncture treatments beforehand?
Absolutely. you can definitely get treated beforehand. As Steph here mentioned, that'll help prime you for when you come in for surgery. And if you're coming in for December, that is plenty of time to let your surgeon know, and then their surgeon is going to let us know so we can get set up to see you in December.
If my husband needs an operation, is it wise to ask his doctor about this at the VA hospital on 23rd Street?
I'm not aware of anybody at the VA who does this, but you can ask, and if there is somebody, then absolutely, yeah.
And the VA, the military, is one of the big proponents of acupuncture. And so while you might not be able to get intraoperative acupuncture, someone at the VA will likely be able to point you to someone who can get pre- and post-operative acupuncture.
So this is a good question. Are you needling patients before or after they're anesthetized? And both ears or just one?
Yeah. So after.
Yeah.
Yeah. Oh yeah. So after. So patients. So we do everything that we normally do. We get you in. We get you hooked up to all the monitors so that we're monitoring you. We do our nerve blocks. We do the spinal. We get you sedated, and you're just chilling. And then we put the needles in. We do typically ipsilateral ear, which is same side of your body, and that has to do with logistics of positioning sometimes. And if you don't have, some patients just don't have one ear for whatever reason, surgeries, etc. We will move to the other ear. And then the specific points, I mean, I'm just going to go very quickly for this particular question. So it's hypothalamus, amygdala, hippocampus, prefrontal cortex, point 0, Shenmen, insula, and vagus.
Now we have someone saying that I'm a candidate for the double hip replacement. Can this be used considering considering that I'll be moved during the procedure? Can this be done for my surgery?
Yes, definitely this can be done. The procedure, yes, you'll be moved in the middle, but our acupuncture protocol would be done prior to that movement. And as I mentioned previously, the needles would stay in for 1 hour, and one side is going to take longer than an hour.
Depending on the surgeon.
Well, for the total amount of time
that
that you'll be on that side, it will be longer than an hour. And so you would be able to get this acupuncture for your procedure. Absolutely let your surgeon know, and we'll see you then.
Yeah.
How does acupuncture impact recovery from whether they get general anesthesia versus epidural anesthesia?
Yeah, so there's not a lot of research on the difference between general anesthesia and neuraxial anesthesia, or epidural, which is a type of neuraxial. So there has been research, like fMRI research, with patients who are under general anesthesia versus patients who are awake. And the brain just lights up differently in terms of that. So that's why we chose to start with patients who are sedated, because there's not existing data on the difference between sedated versus awake. But if you look at fMRI studies that exist, in those patients that are separate from acupuncture, the pathways that are needed for acupuncture still, they remain active in sedated patients. So that's why we sort of chose to do that. Just because the brain lights up differently, does that mean anything different? We don't know. We are going to be moving into spine shortly. Again, a lot of this has to do with logistics and how many people are available to do the acupuncture for patients in the hospital. And so far, preliminarily, very anecdotally, because we don't have enough numbers in terms of for patients, there does seem to be maybe a slight improvement in especially nausea, vomiting specifically. But the other stuff I can't really say. I can only anecdotally say, people have liked it at least. And there hasn't been any negative issues associated with it. So, yeah.
And Steph means anecdotally, we've seen improvements in nausea for general anesthesia patients.
Correct.
All the research and all the results that we've discussed during this webinar have been on sedated patients.
Correct. Yes. Thank you, Chris.
So one specific patient said that my surgeon said they do epidural. Is that part of your plan?
Usually, if there's no contraindication, meaning you're not on any blood thinners or your blood shows that it's extra thin on the day of surgery, because what we don't want to do is harm you. That's our number one goal. We don't want to do any harm. So for 99% of patients, we do neuraxial technique, which is a medicine in the back that numbs you from the waist on down. Yes.
It might not necessarily be an epidural, but it would be an injection in the lower back.
And then after the surgery, does HSS, or do you do it post-op as well before they go home?
We do not.
No,
not at this
just
point.
intra.
Again, logistical issues.
Okay, so that's all the questions I see. I want to thank you both for coming.
Marko, thank you
Thank
so
you,
much.
Marko, for being here.
Yeah, Marko's the best. He really does
Yes.
helps us out with everything. He's an amazing research
We
coordinator.
would not be able to do any of our research
no,
without Marko.
no. He's amazing.
All right.
Thank you all.
Yeah.
Yeah.
Thank you.